Alright, so we're going to do some skills today. First, I'm going to palpate the semitendinosus. It's one of the muscles in the back and the hamstrings. So, if you could just hold that there for me, please. Don't let it push you down. Semitendinosus is that one that pops out right here. So then we palpate up along the muscle belly. Make sure that get all the way up into that ischial tuberosity, which is up here. Right in there, you palpate for that bony tuberosity right there. And the insertion of semitendinosus is down here on the pes anserine. We'll flip over and see that if you flip over for me. So, pes anserine is right in here. You just palpate for that bony tuberosity. Okay. So now, if you can flip over on your stomach here again. The next muscle that we're supposed to palpate is the piriformis. So, you find the greater trochanter, go back and forth, and you find the PSIS, the greater trochanter, and the sacrum. That piriformis is right in the middle. And usually they'll jump. So, piriformis externally rotates, so you palpate along that muscle. So it goes from the sacrum to the greater trochanter. So you palpate along there. And it's a 3D structure. You gotta get there and a little deeper. So those are the muscles that I had to palpate, and I identified ischial tuberosity and the insertion of semitendinosus. So now I'm gonna do some effleurage of the right calf. So for effleurage and for the calf, we want the patient prone. We're going to use a lubricant, so we're doing some free up right now. So you get some of that free up. Make sure you get it nice and moistened up in that calf. The whole point of effleurage is kind of just getting that, you can relax, actually that's good. So you're doing this pre-event, just nice smooth strokes from distal to proximal, looking for tissue change, crepitus, redness, any sort of deformity in the muscle. You're trying to just get that nice and loosened up. You're not trying to dig in there. Effleurage is just more superficial types of strokes, more relaxing, and you're just going back and forth. You kind of want to do it in different ways where the muscle fibers orient. So gastroc soleus kind of orient like this. So if you go along the muscle belly, this will be effective. And you can do this for about 5 minutes or so. So you want to kind of use all your hands, not just your thumbs. You don't want to waste your thumbs. So someone with bigger hands like myself, this is an easier type of massage to do. So that's effleurage. And then we're also going to do friction massage of the right patellar tendon. So if you can flip over for me. So we do not need any sort of lubricant for this, but we are just going to give him a little bit of a bolster underneath his knee. So it's nice and relaxed. We find that patellar tendon. So with friction massage, you're just trying to get into that tissue and really just create blood flow, macrophage formation, and you really want to get into that tissue and perform a friction type of movement along that tendon. And this is more commonly done on smaller structures like tendons, scars, trying to just break up those adhesions if you've got scar tissue in there. Also just trying to get that blood flow coming into this. It would be great for patellar tendonitis. You're just doing nice strokes back and forth to try to get that blood flow in there. And this can be done in any sort of event, pre or post. It's more patient driven. If they have got some pain, you could try to get that pain out by doing this massage. And you're really putting some good pressure in there as well, trying to get into that tissue and giving that friction type of feel to it. Okay, so the final one of the skills today is going to be skin rolling of the lumbar spine. So if you flip over, so skin rolling is used for type of myofascial restrictment. If they've got myofascial or connective tissue type of restrictment down into the joints, this is a great one to try to get underneath and roll that and pull that skin up. So you want to take good, nice grab of this tissue and just start rolling it up. So this is kind of free flowing right now. If the skin was restricted, it's going to start falling out of your fingers. Like up here it is, it's starting to fall out of the fingers a little bit. And then this is actually a lot better. So I can kind of tell that there is some restrictment right here. And you would like to do that in all sorts of directions because myofascial connective tissue is kind of like a web. So you want to really try to work all directions so you can get those restrictments out of there. And the patient probably won't like this. This is not a very comfortable sort of treatment, but this can be used post-event. So getting that skin to kind of lift up off the actual restrictments in the muscles or in the bones. So yeah, that's it.